Bismillah ar-Rahman ar-Rahim. This lecture will be about the plasma volume changes. This is sometimes we face a problem of hydration or dehydration. So what is the effect or impact of this change with the dehydration or hydration on the ABG? Look at this is a patient with depletion, with dehydrations. If the patient suffer dehydrations, this is look at these interpretations. The dehydration, if the patient have sodium 140 and chloride 110, the strong and difference according to this slide will be 30 milliequivalent per liter. Strong and different 30 milliequivalent per liter. This is the difference, not the difference between positive and charge. No, no positive and negative. This means that this is the 30 negative. This is the 30 milliequivalent to be added to 140 to give an electroneutrality. 140 should positive should equal 140 negative. But what we measure is chloride, so the difference, this is a negative charge, and this usually bicarbonate or hydroxide group. So this is hydroxide, so the strong and different 30, this is, means OH hydroxyl group is 30. If there's some sort of dehydration, suppose we dehydrated this patient to the 50%, and the sodium instead of being 140 would be 280. The chloride instead of being 110 will be 220. The difference would be 60. So this is a stronger and different 60. It's more than 30 or more than 40. This means that some sort of alkalosis. 60 means 60 hydroxyl group. This means that the hydroxyl group will increase. Hydroxyl group, this increased due to number one, this is dehydration. Number two, dehydrations will be associated with increased assimilation to the systems, and aldosterone will be increased, and this will stimulate carbonic anhydrase, and carbonic anhydrase will stimulate reabsorptions of sodium bicarbonate. So in cases of depletions or dehydrations, these hemoconcentrations with increase in the hydroxyl group, and this will be associated with concomitant decrease in the hydrogen ion, because the two together will give us BK14 we've mentioned before. So this is an important point. So the dehydrations will be associated with increase in the hydroxyl group or strong ion difference, or the bicarbonate as a hemoconcentrations, and in addition to these formations or senses of bicarbonate or hydroxyl group by the aldosterone through the carbonic anhydrase, with concomitant decrease in the hydrogen ion. This is this is a case of metabolic alkalosis. When you look at this is a normal value. Here, this is a doubling of the normal value. Total weak acid will increase, doubled. Bicarbonate will be doubled. Sodium will be doubled. Chloride will be doubled, and the ratio between sodium and chloride will be the same. This means the heme concentrations, strong and difference is increased. Buffer base has been increased. Oh, this is the data for dehydration. When you look at the other problem of hydration, so ultimate expansion, when you add the volume is increased, so this is some sort of hydration. This is this is a normal value. If you decrease to the 50%, so the sodium will be 70, chloride will be 55, strong and difference will be 15. This means that the hydroxyl group will be 15. This means that there's some sort of acidosis. Acidosis, this is a decrease in the hydroxyl group will be associated with concomitant increase in the hydrogen ion due to the pK should be kept constant 14. Decrease in one will be associated with increase in the other. So this is a case of acidosis. The same thing when you look at that, this is decrease in the total weak acids and decrease in the bicarbonate, decrease in the buffer base instead of 40, it will be 20, something like that. Decrease in sodium and chloride, but the ratio is the same. This is hemodilutions, and so this is a case of metabolic acidosis. So the plasma volume changes when you look at that. First, you have to look at for the sodium and the chloride, and when you look at the relation between sodium and chloride, this will be the same with a dehydrations or hydrations. Dilutions means acidosis, dehydrations means alkalosis. This a very important point. When you get the value of the sodium, don't make a comment except after you look at the chloride. Increase in sodium should be associated with increase in the chloride. In case of heme concentrations, the ratio will be the same. This is a normal. This is normal ratio. This is heme concentration increase. The ratio between chloride and sodium would be 74%. If there's some sort of dilution, so look at the sodium decrease to 131, the concomitant decrease of chloride will be 97, and the ratio between the two 47. So don't make any comment on sodium except when you look at the chloride. Is it heme concentration or heme dilution? Or addition or this is an extra addition of sodium alone, like sodium lactate, sodium acetate, something like that, or sodium bicarbonate, and this is will add sodium or chloride. This is patient is having a decrease in the chloride, like in case of vomiting, or increase in the chloride, like in case of diarrhea, something like that. This is a very important. We are going to talk about it, and this is the formula how to measure the water deficit of the patient. And thank you.